Hello, this is Dr. Jason Munsell. It is about close to 1 o'clock on Wednesday, July something, 12th. I'm going to go over a little bit of chapter 2 for you, and hopefully this will be a little bit brief. I have emailed everyone, you probably saw it already, just making sure that everyone's out there. Only about less than half of you, at least when I looked this morning, had tweeted or engaged in the first prompt for the forum. And this whole thing is asynchronous. That is, you don't necessarily have to do things at a particular time. And again, I'm giving you until the end of the day on Sunday to finish some stuff up. But at the same time, I don't want you to get totally behind. Ideally, you won't wait until the 4th week to do everything, because we go through these stages of the process. In any case, and also remember that the first big thing, and I'll have some sort of point system for you tomorrow, is due this Sunday, and that is that dialogue or that that discussion, the debate, whatever you want to call it, between Obama and Trump regarding healthcare. And I'll say more about that tomorrow. This is, look, such a pretty landscape, because chapter 2 is all about the landscape for health communication. So some really interesting things in here. First, poor Julian. Man, she or he is not doing all that great. Julian's stomach is still bothering him several days later. Oh, Julian is in class. Begins to feel queasy. That's weird, he thinks. It's probably that late night pizza catching up with me. You shouldn't eat pizza late at night. Or maybe it's the stress of the final exams. He rubs his tummy and tries to concentrate. Poor Julian. Okay, so this stuff about current issues in healthcare is part of the landscape. I think last time or yesterday I said preventative care instead of preventive care, and I'm probably a typo in the PowerPoint as well, but it is preventive care. And I did end last time with saying that you can understand, sort of interpret the philosophy of this author, that she or he is all about preventive care. And that's really the first big section in the beginning of the chapter here. What we have in the United States, for the most part, is reactive care. We deal with folks once they're sick, right? And so, what would happen if folks didn't get sick to begin with? Prevent illness. Isn't that an amazing concept? For instance, unlike the United States, however, Japan invests its much smaller budget heavily in prevention, regular care, and early detection. Partly as a result, Japanese citizens live an average of 5 years longer than Americans, and outperform the United States on many other health indicators as well. As you're reading through this, you can probably go get sort of angry. The United States doesn't. Well, maybe we do need to make America great again. Losing the health care, if it ever was great. Oh, well, in any case, yeah, we need more preventive care. What I have for you here is from the CDC, if you're interested in it. It just sort of gives you more information about what preventive care is, what's the problem. Nationally, Americans use preventive services at about half the recommended rate. Cost sharing such as deductibles, co-insurance, or co-payments also reduce the likelihood that preventive services will be used. One study found that the rate of women getting a mammogram went up as much as 9% when cost sharing was removed. So it talks about all this stuff. Who's at risk? Can it be prevented? The bottom line, case examples. But in any case, it's good to go get checkups, prevent illness, and eat, your Wheaties and oatmeal and stuff like that. Sushi. Okay, there's more. So that's one of the issues that we're dealing with, particularly here in the United States, but everywhere, obviously. We tend to focus on helping people once they are sick instead of trying to prevent the illness in the first place. Reactive. And that ain't good. All right. Money, money, money. Cost efficiency is the next little section. And the idea is, obviously, if we did more investment in preventive medicine, we would save money and lives. But particularly in the United States, the United States spends 11 times more on health care now than it did in 1980. I love the 80s. I came of age in the 80s. I was like a walking John Hughes movie. But in any case, and far more per citizen than any other nation. We spend more money per citizen than any other country on the globe. However, the United States, lags behind other industrialized nations in terms of equitable care for all of its citizens. The upshot is that despite large budgets, treatment delays are common, and many people receive almost no care at all. That's the upshot. Nearly everyone agrees that the system must become more efficient. So we got to figure out how to, decrease costs. So that's another big issue, cost efficiency. And it talks about Medicare and Medicaid and how that has expanded. But even so, by the year 2010, nearly 50 million Americans, about 1 in 6, were uninsured, reflecting the reality that insurance premiums rose 10 times faster than wages between 2001 and 2008. Yeah. And going back to preventive care, if you don't have health insurance, you're not going to do all that stuff. You're going to get sick and go to the emergency room. All right. So basically, it might seem that this would save the system. Blah, 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 blah. As you might predict, people without insurance tend to forego regular checkups and health screenings and seek care only when they are seriously ill. It might seem that this would save the system money, but as we discussed, the opposite is true, since prevention is more cost-effective than treatment. In states with the largest number of uninsured residents, health care costs are higher, as much as 5 times higher. And we got wasteful stuff, duplications of tests, and the managed care tried to do some of this stuff, but there's still problems with that. By the way, I like these. Can you guess part 1 and part 2? And it says answers appear at the end of the chapter. But if you're like me, you're so excited you had to go to see what the answers were. So, can you guess part 1? What percentage of Americans who go bankrupt do so because of medical bills? I don't know. 10%. What percentage of Americans who go bankrupt because of medical bills were insured when their health crisis began? I don't know. What is the average medical debt that drives people into bankruptcy? I don't know. Let's see. I'm cheating. Answers. About 50% of Americans who go bankrupt do so because of medical bills. Holy crap. About 75% of Americans who go bankrupt because of medical bills were insured when their crisis began. Wow. The average out-of-pocket medical debt for those who go bankrupt is almost $12,000. Wow. And what about the part 2? What percentage of U.S. residents age 65 or older are uninsured? I don't know. 25%? Probably more. Prior to the Affordable Care Act, passed in 2010, the number of uninsured residents in the United States was equal to the population of which state? And I know this is messed up because they already say 50 million Americans are uninsured. Well, that was 2010. It's a trick question. The answers: only about 1% of Americans over 65 are not insured. That's good. This is largely because 90% of older adults in the United States qualify for Medicare. Number 2, it was a trick question. The number of uninsured Americans in 2012 was equal to the population of Maine, Alabama, Oklahoma, and Alaska, Arizona, Colorado, Connecticut, Delaware, Hawaii, Idaho, Iowa, Kansas, Montana, New Mexico, North Dakota, Oregon, South Carolina, Vermont, West Virginia, and Wyoming combined. Okay, so we're dealing with issues, preventive care, we're dealing with issues of money and cost, and we're also dealing with different approaches to treatment. So lots of stuff here. Mind-body dualism. That is Rene Descartes. The S is silent. It's not Descartes. It's Descartes. Dude is ugly. Look at him. He's the guy who said, or we say he said, I think, therefore I am. Which really, the idea is I can reflect and think about my own existence and therefore I exist. Or here, I think I'm sick, therefore I'm sick. Which actually, we can make ourselves sick. But mind-body dualism. Oops. Basically, the idea here is very closely aligned to the biomedical approach or perspective. Basically, this idea that the mind and body is separate, that they are different entities. And Descartes didn't really, he was a mathematician more than anything else. But when we're thinking about Descartes and within the medical situation, when we separate these, some of the implications, for instance, we separate how we treat the mind and the body. Most of the general practitioner, most folks treat the physical body, right? Not necessarily the mind, or if somebody wants to treat the mind, they go see a psychiatrist or something like that. So it's like it's separate. So it says here, for the most part, medical doctors, internists, cardiologists, neurologists consider it their primary function to treat physical ailments. And of course, then the stigma also with mental illness and everything like that, that they are separate. But generally, when people say they're sick, it's of some sort of physical ailment. Although that's changing a bit. But it is the most popular way, I think, of thinking about approaches to treating disease these days. Even though people obviously understand the connection, that there is a connection. And Descartes didn't really know, well, sort of knew what he was doing, but that's a very old perspective, because there's always things going on in the unconscious. Oh, do we really have choice? I don't know. Some people argue that the subconscious, the unconscious, is actually more powerful than the conscious. Who knows? We're all living in the matrix. Canoe. Okay. The holistic approach